Just relax for me. Okay, good. If it's uncomfortable, just let me know.
Yes, Dr. Rodriguez. I will let you know.
Ooh, okay. Try not to move your jaw. There's a point right there I'm trying to get. If I go this way, I'll hit the skull, and I'll burr the tip of the needle, and then I won't be able to use a needle again. This way I get the whole temporalis, all these trigger points.
Do you know what this
Oh, okay, 1 second, thank you. Something there. I'm going all the way across. Wasn't too bad, was it?
No, not at all.
Okay, good. So I'm going to do the same technique on the masseter. Make sure that's not bleeding. Okay, relax your jaw for me. Oh, no, close it. Okay, good. And just relax it. So that's the zygomatic, and I'm just going to pack here and just get all this part of the zygom, the masseter, I mean. You okay? Oh, okay.
Mm-hmm.
It's kind of soft. I don't feel very much there. But that's just a demonstration. You can pause it.
It's looser. It feels good.
So
it feels like the
so
pressure is off.
So it feels looser?
Yes.
Okay, good. I'm going to finish it up now. And this is just another technique. This is basically gun. And I'm just going to needle this whole masseter. Technically, this is dry needling. I don't like using the word acupuncture anymore because it's a bad word. Bite down for me. Okay, relax. Okay, good, relax. Going all the way into the mandible, because if you don't go the full extent of the muscle, you're only half stepping. And there's a point right here. I'm gonna change needles.
The mandibular
the bone, the
junction
joint. Yes, we're loosening up that joint. Well, yeah, we're releasing the joint, but the muscles bind the joint. So joints don't rust. They get bound by muscles. So you release the muscles and you release the joint. But there's one here. Okay, open wide. Okay, good. Hold it just like that. This is the pterygoid. I'm going to try to get there. You move this way so you can see. All the way in. And then, ooh, it's sticking. A little stick there, a little jab there, and good. Okay, relax the jaw for me. Yeah, you can relax, yes. Okay, good. So, I'm gonna do both sides, and you can pause it. Okay.
Be quiet, right?
No, you can talk. Open. Okay, good. Relax. No, not too much. Okay, right there. Perfect. Once she opens, there's a little pocket right there, and that's where I'm going. Okay, you can relax for me. Good. Okay, just open and close your mouth. See how it feels. Just kind of regular open, close, open, close. How does that feel?
It feels very nice.
Okay, good.
Loose.
Okay, let me finish it off. So I'm going to finish this off. Usually once you use a needle, it'll become it'll drag more and you can't feel as much. It's almost like the tip becomes flat, and I like to feel what I'm doing, and if the tip is flat, you can't feel as much. You okay?
Yes, I'm fine. Thank you.
Usually if your eyeballs aren't stay in your head, then I'll keep going. But if you need me to pause, just say so.
I don't need you to pause.
Okay. Open wide, close. And just kind of open, close, open, close, open, close. If you're going to release a muscle, you have to stretch it back out again. If you don't stretch, you could potentially waste your time. Without the stretching, everything locks back up again. Okay, so just relax for me, good. So, there it goes. When you do this temporalis, you have to make certain that you tap the bone, because sometimes one of the triggers is so dense that you think you have gone the full extent of the muscle. But if you push a little harder, it'll give. So there's a hard stop and a soft stop. Now that's a hard stop, good. Okay, open, close, open, close. Now, part of her problem is her neck, jaw, face. So if I work on the head, I also work on the neck. So I'm gonna turn her over and work on her cervical muscles, and that's it. Thanks. I'm gonna release the back of her cervical, all these cervical muscles, and the base of her skull is here, and that is basically C2. So there's a triangle here where the artery goes into the vertebral artery goes into the base of the brain. So if I work in this area, I always use just a plain needle, not a sharp needle. But I use this as a guide, and C7 is probably there. It's hard sometimes distinguishing it, and you can try to count down. That's 2, that's 3, that's 4, that's 5, that's 6, so that's 7. And what I do is I release all of them, because they're all involved. And so I just go laterally a little bit, and there's the muscle right there, and I'm gonna get it. And really, you can take that all the way down to the bone until it stops, hard stop. And that's it. I'm just going to kind of massage it a little bit. And you can see it's bending, and that's normal. So sometimes you need a stiffer needle to get in there, because it'll just bend. Let me show you. See, it'll just bend. So you have to use the proper needle to get to reach everything. And this one is a little too thin, and I'll get a larger one. But this is for demonstration, and I'll fill in the gaps later. Thanks. You can turn it